Thank you so much. And Elena, would you please introduce yourself and then let us know your job title and exactly what you do?
Hi, I'm Elena Michelle Cohen. I'm Chief Operating Officer for Psych Solutions, and I started out as a therapist. And when our Director of Operations left, we created the position for Chief Operating Officer. So the departments I oversee on a daily basis, we have a community outreach team. And some of them actually have a healthcare administration degree, but they enjoyed the community outreach aspect of it. So they go into the community, they connect with partners and people who are interested in mental health, provide different resources for them. I have a team that's psychiatrists, and with psychiatrists, sometimes you got to hold their hands a little bit. So we help them with their billing. We help them set their schedule. We make sure that the medications are going smoothly. In July of last year, everybody in Florida switched to online prescription writing. So that was difficult for some of our old school doctors. We helped them with that transition. I oversee the therapists and case managers. We are a for-profit mental health company. So the therapists and case managers are going out in the community, providing therapy, providing resources. It is a Medicaid population, so not all of the therapists have to be licensed. If you have a bachelor's in the healthcare field, you can become a targeted case manager as well, which some people then transition from that to becoming a therapist. Our intake department is where we get all the phone calls, and bless them, because some people are calling very stressed out, very upset. Their child has just been Baker acted. They're connecting with the hospitals, making sure that goes smoothly for us. And then the final department I oversee is human resources, which is a small team for us. It's just 2 people. But the human resources department, one of them also was a case manager and then transitioned. So there's so much growth and mobility in the healthcare field. And the great thing is, if you find a position you like, you probably already have credit and experience from one of those degrees. You can transfer to another department or go back and get some added classes. So those are the main 5 departments that I oversee on a day-to-day basis.
Thank you for that. Okay, so can you maybe talk about any kind of challenges that you might experience on this job? And then also, what are some things that you really, really love being a CEO of this company?
Absolutely. So the biggest challenge when I came in is we wanted to create a private practice insurance group that accepted private insurance for therapy. When you have Medicaid, you do have a lot of options for receiving therapy, but when you have private insurance, it can actually be more difficult in many instances. You have to credential with each private insurance company, which is reams and reams of paper you're sending them. There's only certain times of the year when they may be open to receive new providers. And you kind of have to convince them sometimes that you're going to be a good provider and provide good care for their recipients. So that was a big challenge for us. In some ways, the pandemic really helped because it made this huge push to show that mental health was important and a lot of people were struggling. So that was one of the big challenges. And then also as COO, a lot of complaints came into me. And oftentimes parents, patients, customers, they're not so much angry with you as they are angry at the situation and frustrated and upset, or medication's not working as quickly as they would like. So if you're in any customer-facing position, you have to take yourself out of the equation. Understand they're not upset with you, but it's a stressful, high-pressure situation for them. So also learning yourself how to cope and deal with the pressures of the job, whether you're in a hospital or just a small pediatric clinic, is really important.
Thank you for that. So there's another thing that I wanted to ask you, because a lot of students, when they contact me, a huge factor in what, gives them the decision is like a deciding factor on whether or not they want to pursue a career in healthcare and whether or not they want to go very far in healthcare is the stress factor. Mm-hmm. So what is the stress level of this position?
Well, there's certainly stress, but there's reward. So if you're the kind of person who gets satisfaction from seeing people change and grow and be happy, this is going to be an excellent position for you. If you get stressed out very easily that you can't help somebody like this or resolve their problems quickly, it might be too stressful. So you have to go into it knowing it's going to be a process. That from the time a client walks in with their problem until 6 months, a year, 2 years later, when they're feeling confident and happy and healthy again, that's going to be one of the issues. But I have to say, the people are amazing. I mean, all the coworkers I've worked with, my colleagues, my employees, they're so supportive and wonderful, because usually you get into this, you have a big heart. So on days when you feel like you might be losing your mind, they can call you up and cheer you up. And it's such a great community that everybody works together and knows each other. So there is some stress to it, but you're in there with other people who are willing to lift you up and support you. So I find it to be manageable, but in situations where there's deadlines, insurance companies calling you money, payment, you definitely have to be a little bit patient with it, because it's a big bureaucracy in some areas of healthcare.
Yeah, I understand that. So you started as a therapist, is that correct?
Yes, mental health therapist.
Perfect. Okay, so going from a mental health therapist to where you are now, can you speak on maybe the stepping stones that took you to get to this position?
Absolutely. And mine is an unusual situation, most likely. So it won't happen for everybody. Everybody's paths are different. I started in a nonprofit company, and most people might not know this. Miami is the #1 fraud capital, Medicaid and Medicare fraud capital. And I took a lot of ethics courses in my degree, so it's something I felt very strongly about. And at the first company, when I would speak up about things I noticed, it seemed to me they didn't really appreciate that or take it into consideration. So that's when I switched to my current company, and they were so much more receptive. So they will gladly tell you I was kind of a pain in the butt in saying, well, why do we have sick and vacation time? Why don't we have PTO? And well, why are we billing things this way? We should do our notes in the session with the client, collaborative documentation. So I took it upon myself to always be offering advice and suggestions. And when that position opened up, I thought, well, this is a long shot. There's clinical directors, clinical managers, people much higher up than me. But I came in prepared and excited about it. And when they saw that and saw the motivation I had for it, and that I wanted the company to succeed, right? I wasn't offering all these suggestions just to, you should do better, but we could make more money if our clients are happy and then our employees are happy. So that's when I was selected, not only from within the company of people who've maybe been doing it 10, 15 years, but they interviewed outside the company as well. And I was so fortunate. I really appreciated being given that opportunity. And it kind of goes to prove, in some ways, if I could do it, anybody could do it. If you have that thirst, that drive, that knowledge, that motivation, there's limitless opportunities, because this is such a growth environment, especially right now. There's so many mergers, acquisitions, companies. Amazon is doing telehealth. I mean, really, this is the best field and best position you could be in if you want to join this field right now.
So did you have any, mentors or anyone like that who may have guided you through this process?
Absolutely. I had a boss who was from the first company, and when I moved on, she moved on, but we stayed in touch. Now, she had a degree in social work, mental health, and marriage and family therapy. All the degrees you can have to be a therapist in Florida, she held here and in Kansas. So she really showed me how many different opportunities there are. You can license people, you can credential people, you can work with people. And she moved on to do a dialysis clinic. So there's even mental health and dialysis, lots of places you might not expect to find it, as well as healthcare administration. So she really pushed me not to give up, not to say, well, this is the best level I can make it to until I do X, Y, and Z. So her pushing me really helped me to see, if you believe in yourself and you want it badly enough, there's so much opportunity to go after it. So I appreciate her for that.
Yeah, I would say that mentors mean the world of a difference in my experience, and also with But everyone I have spoken with so far, everyone's just talking about how mentors are what you need if you really want to move far in this industry. What about networking? How has networking played in like the growth of your career? And then maybe do you have any tips, any networking tips for students?
Sure. So it's so funny because Miami is a big city, but it's so small when it comes to healthcare administration and health and hospitals. Once you're in for a little bit, everybody kind of knows everybody. So it's good because people will know you and know your name, but then it's important to make sure you're coming across the best way possible with a good reputation. So knowing a doctor from this hospital helps you get referrals from them, helps your company grow. Having our community outreach team go into high schools and middle schools and daycares helps get the word out, helps people want to connect with you. And going to different events we had or things that were being hosted by nonprofits was important. Certainly being LinkedIn, having a connection like you reach out to me, those things are wonderful. And if you're introverted or shy, like I am sometimes a little bit, you don't have to try to connect with everybody. But if you're kind and genuine and honest with the people you do meet, your name gets out there. And so that's a wonderful thing when you go to someone, they say, oh, Psych Solutions, we know who you are, hopefully with a smile on their face. But that's a very good feeling when people have heard of you and have a good clue about who you are, that you can connect with them.
Absolutely. Reputation is everything in really any industry. Okay, so I think we're coming towards the end. And so thank you so much for this. But do you have any advice that you would offer to an undergraduate who may be close to graduation or maybe a recent graduate trying to find their first job in healthcare?
Okay, so I'll give two pieces of advice. The one that helped me the most, and I was warned not to do it the whole time, but it worked out very well, is to be honest. If you see a problem, say something. There was a long time culture of, well, you just kind of keep your mouth closed and keep your head down and do what you're supposed to do. But because of the innovation and growth factor in healthcare right now, they're looking for people who are willing to be honest, willing to think outside the box, willing to come up with new ideas and inventions and ways to do things. So don't be afraid to be yourself and be honest and come to your bosses with ideas or suggestions, because if you're at a company that appreciates that, you're going to move up. If you're at a company that doesn't appreciate that, you're not going to want to be at that company for a long time. But in terms of advice, I could say that telehealth, working remotely, is a wonderful thing, but it's also important to have a connection with your coworkers. So remote jobs are great, especially if you're good at working on your own, but it's also a good time to be at a hospital, at a clinic, at a doctor's office. And maybe you start out as a secretary and you think, well, what's this going to lead to? But at our company, we promoted all of our secretaries. One became a human resources. One became the human resources assistant. One became our intake phone calls team leader. She just got a promotion and a raise. She's doing very well. And one of them worked into doing kind of like finances and working with the billing team. So if you work hard and you do well, there's so many careers and avenues. Even if you kind of started a position you think is a little, maybe less than what you were hoping, within 6 months, we had promoted all of those people. So don't give up. There's always a lot of opportunities out there.
Thank you so much for that. I think this has been so helpful. You provided so much value for our students. If anyone wants to reach out to you or ask you new questions or anything like that, how can they do that?
Yes, absolutely. So the best way to reach out to me would be on LinkedIn, Elena Michelle Cohen. I do have an Instagram at The Helpful Therapist. If you're interested for any of that, feel free to message me. Any questions you may have, I would love to honor that mentoring that I got and helped other people in any way I can as well. And thank you so much for having me. I really appreciate it.
No problem. Thank you so much. You have a wonderful day.
Thank you. Bye-bye.
Bye.